Hi, I'm Mel Van Dusen, and welcome. This could very well be the most important show I ever do, because if you listen carefully to what our guests have to say, it could save your life. Dr. Martin Fenstersheib is the health officer for Santa Clara County, and Marsha Hovey is coordinator of emergency services for the city of Cupertino. And tonight's topic is pandemic influenza. Marsha, welcome to the show.
Thank
and
you.
Dr. Fenstersheib?
But call me Marty,
Thank
please.
you. I will do that.
That's a mouthful.
That's easier.
Yeah, make it easy for you.
Yeah. How do you get your point across to people who are burned out on fear?
It's really important for people to have perhaps a little fear, because I think that's somewhat motivational, but not to the point where you can't act. And so I think the information, we give the truth, give the information, and then allow people with some guidance to get prepared. Because people get more fearful when they don't know what to do. And I think we tell them what to potentially expect, and then what to do about it and how to get prepared.
Okay, tell us about pandemic flu. What might be the impact on Santa Clara County?
Well, first of all, the impact on Santa Clara County would depend on the type of flu we see. And we're worried right now because there's this bird flu that's in the world. So if you are a bird, you're in trouble, because that's a pandemic.
Right.
But if that changes and we see a pandemic in humans, then there could be a big impact, especially if it's a strain that's as bad as a previous strain way back in 1918. And then the impact is going to be big. We're going to have 25 to 35% of our population sick over the course of the illness, which could be 400,000 to 600,000 people in our county. We could have several hundred thousand people actually sick and have to go to the hospital, and we may have a number of deaths. We could see as many as 10 to 20,000 people dying over the course of the entire pandemic.
And the Great Pandemic in 1918, how many people died from that in this country? I think it was 550,000?
About 500,000 people.
Yeah.
Of course, if you remember that the population of this country was a third of what it is now. It was 100 million people, so the impact was pretty big. And then worldwide. And
that influence started with bird-to-human transmission, as I recall.
That strain back then, which was called the Spanish flu, 1918, did derive itself and change over from a bird flu strain, an avian strain. So that's what we're worried about right now.
Why is this virus particularly so bad?
Well, you know, influenza in general is spread through coughing and sneezing, droplet contact. And so that's the thing. It's very, very contagious, very, very infectious, because people coughing can spread it very easily. And if it's a bad strain like we saw in 1918, then that very bad strain of flu can make people very sick and a lot of people sick. And it's easy to spread. That's the issue.
And Marsha, what can we do to minimize the spread of this virus?
Well, minimizing the spread is just taking the proper precautions when you're sick, which is something that we should be doing anytime that we're sick. I think we have a slide a little bit later on that talks about you know, the exact things that you should do, but really in order to prevent the spread, you reduce your contact with other people. Do you want to talk about social distancing?
Well, I think it's important just for any respiratory illness, including the flu, to make sure that you cover your cough and your sneezing, and not go to work when you're sick and cough all over. Don't send your kids to school when they're sick, and also to get the flu shot. The regular flu shot every year is important in limiting the chance for this bird flu to change itself into a human strain. So the less regular seasonal flu we have, the better off we're going to be. So I would encourage people to make sure that when the next flu vaccine season comes up in the fall, that they avail themselves of getting the actual regular seasonal flu shot. That's important.
So if you were to get the flu, you would, if you have to be in public, you would distance yourself from people by about, I think, 3 feet, is that it? Keep 3 feet away from people if you have to be in a social situation?
Well, we're going to, you know, I think it's important really to make sure that you do protect yourself and others and to maintain some distance. But what we really are going to do from the public health standpoint, if we are in the midst of a pandemic, we're going to use some of our authority to actually limit the gathering of people. So we will perhaps close malls or limit people from gathering in large groups, closing sporting events potentially. Again, when people gather, that's when it's spread. You're coughing and sneezing all over people. And another thing we may do, which is critical, is closing schools when the pandemic does arrive, because we know that kids are great at spreading germs from one to another. They're great little vectors. They cough and sneeze on everyone, and then they bring it home. So we want to limit that.
And hand washing is critical for that.
Hand washing is the simplest thing, but yet the thing that people forget to do. And hand washing eliminates the germs that we get from perhaps touching a surface that's infected, shaking a hand of somebody else, where we get the infection, the germ on our hands, and then typically we put it up to our face, get it into our mouth or into our eyes, and then we can become infected that way.
Yeah, could we see a visual of the history of pandemics that will give us some idea about when these pandemics happened? Now, can you talk about that a bit?
Right. So right now we're saying, you know, when are we going to see a pandemic? Are we going to see a pandemic? The bottom line is it's not if we're going to see a pandemic. It's when we will see the next pandemic. We see typically every century for the last several hundred years, when you look back, there have been at least 3 or 4 pandemics. This is a look at what we saw in the 20th century. There were 3 pandemics. The worst one was in 1918, the Spanish flu, which we talked about already, killed 500,000 people. And then there were 2 lesser pandemics that people perhaps may remember. The Asian flu in the 50s, the end of the 50s, and then the Hong Kong flu in the 60s. And they weren't bad flus. They were pandemics, but it didn't really kill a lot of people. A lot of people got sick, but it wasn't a bad strain. So we're preparing for the worst case scenario. We're actually preparing and thinking of how we would respond to the 1918 variety. Because we can handle the 1950s or 60s variety. It's the worst one that we really need to be prepared. We don't want to be caught off guard for that one.
And how is this pandemic spread?
Spread, again, by respiratory droplets, so that coughing, sneezing, and I think we have a slide also of somebody that is showing that coughing and sneezing pattern. Typically, those germs are spewed forth very rapidly. Those droplets are actually travel as fast as a car on a freeway. And so if you're sick and you have virus mixed in there too, those germs are going to spew forth. They're going to land on a surface of a table. They're going to land on somebody else, and you're going to pick it up that way and spread it that way. So we've got to stop that.
Right. Maybe you and Marsha can talk about how can people take care of themselves once they have the flu. I understand that it's critical that people prepare at home before the flu strikes.
Right, and we're thinking that with so many people, as I mentioned, being sick, that we know we're going to be overwhelmed. There will not be enough hospital beds, and so people are going to have to take care of themselves and their family members at home. But we're looking at various levels of care, and I think we have another slide on levels of care that we're thinking of. In our plan, we're saying not enough hospital beds, too many people sick, so we need to have people taken care of at home. And then we're developing this concept of an alternate or intermediate care, or what we're calling an influenza care center. So we're trying to develop that concept at this point. So we'll have a facility. It could be a hotel, it could be a convention center, it could be a dormitory, where we basically staff that, equip that, bring in supplies to take care of people that were not able to get into a hospital. But the key is, as you mentioned, people taking care of themselves in their home. And so you want to talk about that?
Yes.
Okay.
Marsha, you have
jump in.
You have cluttered up my stuff with all this stuff.
I have,
Could you tell us
and I did just want to say that the success of our response to any flu is dependent on each individual person and what it is that they're doing to make sure that they can take care of themselves. It's just like any other disaster that we might face. It comes down to you being able to take care of yourself. And so when we talk about the flu, we want to make sure that people are actually trying to stay healthy and doing everything they can to minimize the effects of the flu, and that would start with getting your flu shot, making sure that you're exercising or taking vitamins, you're not becoming exhausted so that you're just, waiting for this virus to hit you. But then at the same time, you want to think about what you're going to feel like if you're at home and you're really sick, because if it's the bad flu, you're going to have serious symptoms for 7 to 14 days. And so during that 7 to 14 days, you don't want to go outside. And during the course of this pandemic, the people that are well are going to be afraid to go outside. So if you're the primary caregiver at your home, and say you're the one that goes to the grocery store every week to buy the food, and now you're sick in bed and your kids are saying, what's for dinner? You want to make sure that you have enough food in the house so that you don't have to go out and spread the germs, or you may not feel like it anyway, but you don't want your family to have to go out and risk getting ill too. So that's one key thing, is to make sure you have enough food in your house and that you can stay there for as long as you need to until you're feeling okay again. Now once you're well, you're immune to the virus, which is the most wonderful thing, is that once you've fought through it, now you can go out and you can help your neighbors, you can buy food for other people. But the key is to do it in advance, because during the pandemic, food will not be on the shelves.
And how much food should people accumulate?
At least a 2-week supply. If you're ill for 2 weeks, you're not going to feel like going out to the store.
Maybe preferably longer than that.
Right, absolutely. The more that you can store, the better.
Yeah. Could you explain what some of these things are over here?
We have two groups of items that we're recommending for people now. The one is what to do if you're sick. And so you see that you want to make sure that the surfaces in your home stay clean, and the easiest and the least expensive way to do that is to make a solution of bleach and water and then just spray things down.
10%.
10% bleach with water.
Right.
You're going to have a fever, so you want to make sure that you've got a good fever reducer there, and remember that children need a different dose or a different type, or if you have infants. You're going to have a bad cough, so you want to make sure that you have cough medicine, and you want to be able to take your temperature so that you can monitor your progress. You may have an upset stomach, so whatever you need to try to help settle your stomach. You may have chapped lips, so you may want some lip balm. You're going to need lots of Kleenex. And then you see that we have a surgical mask there. This is to help protect you from breathing in the droplets that your ill relatives may have, or you can do it the other way. You can put it on the ill relative and keep their droplets to themselves.
When would you wear it?
In your house, but you will see them on the streets, I would imagine, because people are going to be afraid that they're going to catch something.
Right. So we want people to, in their homes, to do a number of things to limit the spread of the illness. And as Marsha said, we need to have certain over-the-counter medications available to take care of that. And separating the sick from the well. You have to have a plan of taking all the sick people can be put in one place in the same area, and the well people should be in another area, and there should be a separate bathroom if you can for the people that are sick. We want you to open the windows, because having air circulate is really important to keep the amount of germs down. So you don't want to, some people may say if you're sick and you have a fever, close all the windows, close it all up.
Or some people might mistakenly think that if we keep the windows shut, we'll keep the flu out.
Right, but we really want the air to circulate, and that's how you keep the concentration of germs down. So actually open the windows and circulate the air the best you can. As Marsha said, you certainly want to, when you're going in and caring for those sick people, you want to put a mask on yourself, but if the person is coughing and sneezing, you want a mask on them too. Right. So we want to try to break that, that potential spread from one person to another. It's very important.
Yeah. What do you think the symptoms would be?
Well, they're going to be similar to any other flu. So they're going to be sudden onset, rapid onset, high fever, headache, aches and pains all over. So if anybody that's ever had the flu knows that once you get it, you're incapacitated. You basically lay down, everything hurts, you can't move. You may have a dry cough, some stomach upset, and everything and fatigue. Just terrible fatigue.
And one curious thing about the 1918 strain was that people with the best immune systems, their immune systems went into overdrive, and somehow the virus incorporated that and made it more deadly.
Right, and so the difference is from usual seasonal flu that we see, it mostly affects and attacks the most frail the elderly, and the youngest. And those are the ones that are at highest risk that we want to make sure we get vaccinated, and those that have chronic illnesses, respiratory or cardiac disease. In 1918, that avian strain caused illness in actually the people that were the healthiest. The youngest, the healthiest, those people that had strong immune systems. It was just the nature of that virus. It actually caused the healthy immune system to overactivate itself, and to a point where the body was fighting itself. And so a lot of many people that died back then were not necessarily the elderly and the young. They were the healthy, young individuals. And we won't know that. We won't know the characteristics of this next pandemic strain until we actually see it, until we can actually see what it does and who it attacks and who it puts at risk.
Right. We've already covered levels of care, but I don't think the pop-up came up about that. Could we see that, the level of care slide? And then maybe we can fill in any gaps about that.
Yeah, and as I mentioned, the hospitals are going to be overfilled, very, very crowded. So the plan is that the sickest people that need the highest level of care will be in the hospitals. That will be the place that people will be able to receive intensive care and also be on respirators if necessary. The least sick people will be in their homes, and that's what we're talking about. We want people to be prepared. Most people can be taken care of in their homes, and we don't want people to be afraid that they can't take care of sick relatives.
Right.
And then the other is that intermediate, as I was talking about. We are trying to figure out an alternative or intermediate care sites that can house maybe another 2,000, 2,500 people at any time, where we could give them IV hydration, where we could give them oxygen, no ventilators, where we could take care of them until they are better and able to go home to their homes and be taken care of.
And what kind of facilities, where would these be?
Well, we're working on that now. We need a place that has the capability of housing that many people, that has bathroom facilities, that has the capability of making food for people. So we're looking at potential hotels, perhaps convention centers. We're looking at potentially at dormitories, or we have a few hospitals in our community that have been vacated for various reasons, and so we're looking at those. We haven't identified them all yet, but we have a group that's planning how we will supply them and how we will equip them, and what we will do there, and who will be staff, who will work there.
If I could just add one thing to that, even though that we are identifying the facilities, we're also identifying the people to provide the care. Public Health has created a registry of medical volunteers, and so we're registering medical professionals that perhaps are in private practice, doctors, dentists, nurses, veterinarians, people that might be able to offer their medical expertise, and we're pre-registering them to become part of a database for all emergencies. But in particular, it's going to give us a greater capability to be able to care for the people at these other centers. And so we really encourage anyone that is in the medical profession to contact Public Health and find out how to get into that registry.
Okay, and we'll give that information toward the end of the program. And then we have some posters that we can see, and you can comment on those. Could we see some of the posters?
It's just some of the community outreach that we're starting to do to educate the public on what they should do, like cover your cough and limit the spread of germs by washing your hands. They are being publicized in different languages, but one of the most difficult parts of the education for the pandemic flu for local government is that we need to be able to reach out to every single person and get this information to them. And the difficult part about that is that not everyone watches television. They don't watch this cable station, or they don't speak English well, or they're suspicious of the government. And so it's a very big challenge to make sure that we have the ability to reach out and help everyone that needs to know how to care for themselves, and that we can provide them the tools to help them do that. And so we really encourage individuals to talk with their family and friends and the people that they know that live around them that may not be getting the word through normal channels or checking websites, and that we make sure that we, as a community, share in the public education aspect to make sure everyone knows what to do to save lives.
Right. Okay, and we have another slide on information, where people can go to for information. And since that's the next on the agenda, let's go to that.
Okay.
People will need to...
Well, there is a lot of information from public health. You can see the website there. There are plenty of fact sheets. One of the best pieces of information you can get right now that's not on the web that you can hand to people is the Pandemic Flu Pocket Guide, which it's just a little green fold-out brochure. By calling public health, you can get an individual copy, or if you have an organization that you want to share it with, they'll give you as many copies as you need to get the word out, and it is in other languages.
I don't have my glasses. Was that on the screen, that contact information?
The phone number for public health.
This is really handy. This really tells you everything you need to know on that. So I encourage everyone to prepare for this and get one of these things. It's really
and it does
prevent the spread of disease at home during a pandemic flu. What you can do. There's something on quarantine here, important phone numbers. So I would encourage people to...
There's a list of supplies.
A list of supplies?
Yeah,
Well, that's great.
Now, the thing that's not listed in that list of supplies is, again, your comfort foods and what you normally eat when you have a bad flu. Because your typical, canned meat and non-perishable foods may not be very appetizing.
Tell us.
Make sure that you've got some Jell-O or some gelatin or chicken soup or bland diet crackers, or those types of things that as you're trying to regain your strength, that you start to eat before you're ready to eat that solid food again. So everybody kind of has their ritual on how they recover from the flu, and just make sure you've got all that food ready for you.
Which brings up the issue of just hydration, because one of the
Absolutely.
key problems in people that develop high fever and flu is they get dehydrated, and that can cause a lot of problems. And so what really is critical for people at home also to know and to be prepared to do is to rehydrate sick family members. And it's very easy to do. So it's just a matter of not worrying about if they're not eating at all, trying to get their fever down, and then just giving them fluids, which we describe in this pocket guide. But it's simple things like Gatorade or Pedialyte for children. It's just a matter of giving them types of liquids, slowly giving them so that they can get enough hydration back so that they don't get dehydrated.
Or just plain bottled water.
Well, you really don't want to just give bottled water, because you don't have the salts and
Right.
sugar in there, which you really need for body metabolism. So you really want to look at the guide and use the proper rehydration solutions, and not just use plain water, but it's got to have some salt in it. It has to have some electrolytes, some salt, and some sugar in it.
I read here in my notes, this pandemic could disintegrate the fabric of life as we know it. That's scary. Could it?
Well, it's going to impact for a time society. It's going to disrupt everything that we know potentially, because people that make sure that our lights are on, people that make sure that the transportation, our safety workers, they're all susceptible. They all could potentially be sick too. Up to 30–40% of the population, the workforce, could be ill. So we have to be prepared for that, and we have to look. We've talked to businesses, and we've said you need to develop a continuity of operations plan. What if 40% of your workforce is out? How will you maintain your services? So that's critical also. So it's not just the medical community and individuals, but it's also businesses and other utilities and other essential services that are impacted. So we're all in this together. It's not just government or individuals. Everybody is in it together.
I think we've got about 1 minute left, maybe less, I don't know. But do you think you've covered all the points? Is there one last thing you'd like to make people aware of that we haven't already talked about?
Well, I just want people to realize that it's critical to have their preparedness kit at home. That we didn't mention about vaccines, but you can get your vaccine for the regular seasonal flu, but it takes 6 months to make a vaccine, so we won't have one at the beginning of a pandemic. So we won't have the vaccine to give to people for the first 6 months. So that's why it's critical that everybody takes the responsibility to get prepared.
Good. Marsha, thank you for being here.
Thank you.
And Marty,
Marty,
thank you for being here. And please prepare for this. Get stock up on the supplies that we talked about. Go to the sites that were provided here. You need the information. You need to be prepared for this. When the pandemic hits, it's going to be largely up to you, so learn to take care of yourself. I'd like to thank you.